Is social media minimizing cosmetic surgery? So I had a patient last week who, as she was coming out of the operating room, she asked, can I go for a coffee? This is like, a few minutes after coming out of the surgery. And then yesterday we had a patient who we were taking to the operating room, and she was surprised that her surgery was being done in an operating room. And they got me thinking of, is social media minimizing cosmetic surgery and making it seem that it's something that it's not? Nobody, whether doing a knee replacement or doing heart surgery, is done in an operating room. They all take these surgeries seriously, but for some reason, cosmetic surgery is being minimized or portrayed as a simple procedure, especially when it comes to eyelids. A simple outpatient procedure, even the terminology that we use, outpatient procedure, treatment, it makes it sound as if it's not surgery. It's not like getting a haircut or getting your hair colored or getting even lip fillers or injections. It's an actual surgery, which means that it's done in an operating room theater. There are certain things you should expect when you're preparing yourself to go to the operating room. So it has to be done in a sterile environment. There's monitors, there's equipment, there's staff, nursing staff, and there's doctors, all for your safety. And then when you leave the operating room, there is a recovery process, just like any recovery process. So nobody would think about going to a coffee shop immediately post knee replacement surgery. It's the same thing for eyelid surgery. You need to go home, you need to rest, you need to close your eyes. There's a whole process. And I've done lots of videos about the recovery process with eyelid surgeries. I'd encourage you to go watch those videos. But it just got me thinking about, how we view cosmetic surgery, specifically eyelid surgery, and how we minimize it as a surgery. And I think it's important that we talk about it a bit more and take it seriously. This is an actual surgery. It has an impact on your function. It has an impact on your appearance, of course. And also, if you're not mentally prepared for it, if you minimize it in your head that this is a nothing procedure, this is like a super simple day procedure, you're actually going to suffer the consequences after your procedure, because you'll realize, oh no, this is not such a simple outpatient procedure. And then there is a recovery process, and there is going to be bruising, there's going to be swelling. You're not going to be able to do what you want to do. You won't be able to go out in public immediately post-op. You will actually suffer the consequences. So I think it's super important. So we try to talk about as much as we can during our consultation process and in our pre-op call and with the nurses, and then I do another pre-operative visit with the patients beforehand. But I think it's more of a mental shift that patients have to take. And I think part of it has to do with the way things are portrayed on the social media. There's like immediate before and afters. People don't see the transitions between the before and after. And there is a recovery process. So you're going to be having some form of healing where you won't be able to do the things that you normally do, and expect that.